Well, I thought the report was typical bureaucratese coming out of Washington. The report called for the big 3 Cs: committees, commissions, and even approving the next head of the CDC at the Senate level. These are terrible ideas. The principal reason that California and Vermont did better was because those 2 states, not only do they have good leadership in public health, but they also have significant investment. When you look at Arizona and those southern states that you mentioned, those states invest next to nothing in public health. So although we've had 4 years of disinvestment by President Trump in our public health system that unfortunately was inherited by the next president, the fact of the matter is Arizona and the southern states have largely disinvested on their own in public health. So without the leadership, without the staff, and without adequate information systems, which we are way behind the rest of the world in terms of our COVID information systems, it's not surprising. And it's unfortunate the GAO didn't go to the heart of the issue and called for remedies that are more or less the standard off-the-shelf remedies.
Will Humble, what do you make of what Gary just told us, that the problem actually goes back a long way? It has to do with planning, with infrastructure. I mean, there was a plan to counter a pandemic, which I think was put together by the George W. Bush administration, but it wasn't acted upon.
Yeah, no, I agree with 100% of what he just said. I mean, that was all really spot on. The poor that you see this incredible difference in the U.S., where certain states did really, really well and others did extremely poorly. And the same states that have poor leadership, who have governors that made bad decisions that were not evidence-based, are the very same states that have not been investing in public health infrastructure and in staff. And so those are two key pieces that work against the very states that performed the worst. And it's not a mistake. It's not, as our governor would say, bad luck. It's not. It has nothing to do with luck. It has everything to do with investment in infrastructure, having adequate, good, well-trained staff, good resources, and then governors that care about the people that live in their states and about evidence and use data to drive their decision-making. And you could look across the U.S. and you see this incredible range of performance, and it didn't have to be this way, but that's how it is.